All right, everyone. Thanks very much for joining us on our media briefing today. We have a lot to cover. We appreciate you joining us. And we're going to get started with the topic of fire recovery. And we are very pleased to have an overview of the Bear report, which was just made public today. And joining us is Kevin Cooper. He is with Resolute Associates doing work on that post-wildfire report. And for those of you who don't know what the Bear stands for in the Bear report, is Burned Area Emergency Response. And Kevin, can you hear us? I think we've got you on audio.
Yes, can you hear me?
I sure can. Thanks very much for joining us.
Yes, you're welcome. So if you'd like me to go ahead, I can tell you just what we've been up to. Is that appropriate?
Yes, please do. Thank you.
Okay, yeah. Hi, my name is Kevin Cooper. I'm actually working right now for the U.S. Forest Service here in the Los Padres National Forest on the Dolan fire and for the Burned Area Emergency Response Team. And we gave a presentation just today through OES on what the results are. And those are going to be made public through the OES here for download probably on Friday or Monday. We have just given the verbal kind of coverage for everybody at this point. We take a look at the burn slopes to see what's going to happen when it starts to rain and what kind of issues are going to occur during those periods in terms of flooding and debris flows and rockfall and things like that. We looked at the entire burned area, and of course the focus here is for treatment for Forest Services are the roads and trails and other values of risk that occur on the Forest Service lands. But we look at all the values of risk across the area, including outside the area of the burn and outside Forest Service lands. And we presented that information to the cooperators so that everyone affected knows the potential for debris flows and high water flows and anything else that might be coming their way so that they can make appropriate plans for protecting their values at risk. It will take a lot of coordination at this point between Office of Emergency Services and all the other organizations that are out there. They were all participating. But as an overview of what happened, it's a very remote area that burned, and there's a lot of values at risk out there, but not as many as we've seen in other fires. Generally, most places are fairly well, homes at least are fairly well protected, but there are some that are down in low-lying areas that will be in jeopardy, and those folks need to contact their Natural Resource Conservation Service representative to get some advice on that one. Of main concern will be the Highway 101 and the access and the impact that it'll have on the potential closure of that highway along the coast. Also the Nacimiento-Ferguson Road and some of the interior roads like North Coast Ridge Road and South Coast Ridge Road. That's going to be a challenge depending on how hard it rains this year. It's all about the rainfall intensity and not necessarily the sum total of rain for the season. But that we don't know, so we'll have to be ready to adjust to that one. Forest Service is working with County of Monterey, Fort Hunter Liggett, and other folks to keep those roads open and prepare them. There may be closures on the National Forest because there's many hazards out there. Besides flooding and debris flows, there's hazard trees and stump holes and all kinds of things that are dangerous for people too dangerous for people to go in there. Actions off of the National Forest will be coordinated by those agencies and landowners out there. Some of the main landowners are Fort Hunter Liggett and of course state parks out there. So our report and the specialist reports that go with it are available through OES starting Monday for sure. Our team has been out here for about the past 10 days, and we're still wrapping up our reports. We're just trying to get the information out as soon as possible. We know that that's crucial for everybody. And Pat here at OES will be able to provide that information as a single point source for everybody to reach in and get those specialist reports and maps. And that's about it. Thank you.
No, thank you. We really appreciate your time. We know that you're just extending your time to join us today at noon. So we really appreciate it. And because we have Kevin for a very short time, if there are any questions about the Bear report, this would be the time to ask them. And sorry, I didn't give you much notice for those on the call, but if you have any questions about the burn report, you can ask them now. And so I'll give everyone a minute to either let me know that they've got a question, or if they want to just ask it, or if they want to put it in chat. I've got some questions in chat, but they are not about the fire. Kevin, if you could hold on just another couple of minutes, I'd like to turn to Rusty Harris Bishop with the EPA. Maybe this will give folks a chance to turn in some questions about the Bear Report while Rusty is talking about the hazardous waste removal update with the fires. Hi, Rusty.
Hi, Maya, thanks for having us back. I don't have a whole lot more to report other than that our reconnaissance teams are out in Monterey County today, which is the start of our household hazardous waste removal process. Basically, what we're doing is we have received the information on damaged properties from the county, and they're going out now as the first wave and looking at those properties and identifying if there are additional hazards like leaning trees, or if there are access issues, narrow roads, or hazardous conditions, leaning walls, those kind of things, and identifying them for the field crews who will be following along a day or two later to do the actual assessment and cleanup of the household hazardous waste on those properties. So we are getting started today with that, and we should see field crews mobilizing to those properties by the end of the week, and hopefully have several teams out working by the weekend, and certainly by the beginning of next week have a full suite of teams working out there. We just had on Monday kind of a small media availability session for folks in Santa Cruz County to observe a field crew in action and take photographs. And so we may do something similar in Monterey once we get up to speed and everything is in place in Monterey. So I'm willing to set that up. We have some constraints with COVID protocols and social distancing in terms of keeping, in conducting interviews, as well as trying to limit the number of people that are on site at any given time, along with restrictions of needing to stay on public right-of-ways when we're doing those interviews and photo opportunities, because while we have the ability to go on site and collect that material, that right doesn't extend to the media. So we need to make sure that we're identifying a property that we can observe the cleanup from a public right-of-way. So I'm going to be working on finding some of those locations and can let people know as they're interested in seeing work going on in Monterey County. But we are moving forward. Our website is up that will be tracking our progress, and people can look up their property and see if they are on the assessment list. And that website is www.epa.gov/2020 CA fire response, all one word.
Thanks very much, Rusty. And you did say that you were starting work today. Is there a particular area you are starting your efforts?
I'm not sure which area. I believe it's in the, I don't actually know. It's either in the river fire area or the Carmel Valley fire area, but I didn't get that in the morning ops brief.
All right, thank you. And then I've got a request for you to write what you just said into the chat if you're able. And then Kevin, I hope I've still got you on the line. I do have a question for you. When you talked about possible closure of Highway 101, what is anticipated if there is heavy rainfall and a full closure of the highway in some areas?
Yeah, so first it's Highway 1 along the coast that we're concerned about, and Caltrans is obviously controlling that, but we understand and work with them. So those closures are going to occur from like rockfall and the things that we normally see that will be exaggerated because of the fire that came through there. So that is controlled not by the Forest Service, but by Caltrans themselves. So we don't have any jurisdiction on that one. I just need to say though that the probabilities of those closures happening are higher because of the burn itself.
All right, thank you. And then are there any other questions for Kevin before he has to leave? We were really fortunate to get him for this overview of the Bear Report. I'm seeing nothing in chat. So Rusty, not Rusty, sorry, Kevin, we're going to let you go. Thanks very much for joining us and giving us that overview of the Bear Report.
Thank you.
Thank you. All right. Then we're going to turn from fire recovery to COVID. And we've got Karen Smith on the line, and she is going to talk about the new pop-up drive-through clinics that the county is launching on Thursday. Hi, Karen.
Hello. So this is a very exciting thing, and it came pretty quickly in terms of how things happen. It's a partnership with the National Guard and the California State Testing Task Force to offer these free pop-up COVID testing. And again, they'll be free. And this one, unlike the two state sites, will be for 18 and over Monterey County residents. And they're going to start on tomorrow and then continue through October 16th. So it's first come, first serve. There's no appointments needed. You know, if you have a valid ID, bring it. That'll help expedite the registration process. Bilingual services are available. It doesn't affect it's not a public charge. It doesn't affect immigration status, which we want to make sure people know. The test will be processed in the state viral and rickettsial lab, one of the state labs. We expect the turnaround times to be 2 days because that's always the other question. So starting tomorrow, the first clinic will be started at 7 a.m. in Gonzales. The schedule is available on our website, mtyhd.org. So tomorrow, the great thing about having the National Guard come is that we can actually do 2 sites at a time. So tomorrow, the 2 sites are Castroville and Gonzales. Friday, it's Gonzales and Soledad. Saturday and Sunday, it'll be King City and Salinas. And they'll be in Salinas Sunday. Monday is a day off, Tuesday. And then they're moving to the Alisal. First, they'll be at Sherwood Hall. Again, this is all available on the website. And then Marina and Seaside as well. So they'll be all over. And we're encouraging people. It's drive-through, so you don't even have to get out of your car. We're encouraging people who are first-line people, so first responders, healthcare providers, grocery store clerks, anyone who has to deal with the public on a regular basis, and those who care for people who are high-risk individuals, and those who also know that they've been exposed, or those who are concerned that they may have been exposed, and you do not have to have symptoms to come to this clinic. So this is a great resource that's come to us, and I encourage people who will need to get tested and want to get tested to get tested.
All right, thanks very much, Karen. And if you would stay on the line in case we've got some questions, that would be great. And now we're going to talk about an announcement from the state about equity metrics that came out this week. And Dr. Moreno is on the line to talk about these new metrics and what they mean. Hi, Dr. Moreno. There he is. Hi, Dr. Moreno.
Hello, Mia. So yeah, hi. Good afternoon, everyone. So Ed Moreno, Health Officer and Director of Public Health. And yes, we have in the state of California, a new metric that's been incorporated into the state's blueprint for a safer economy. So what I'd like to do, May, is just, if that's all right, share my screen. Is that all right?
Yes, please.
Okay. There we go. All right. So do you see the one slide that says new equity metric
Yes, sure do.
and just that slide?
Yes.
Okay, good. All right. So the state of California does have, as part of the Blueprint for a Safer Economy, a tiered framework for assigning counties, and those tiers come with some restrictions on different sectors, but also some permissions for certain sectors to be open and operate. So the two metrics that I think most people are familiar with is one is the case rate in the county, and the other is the positivity rate. So what we have now is a new equity metric, and the purpose of this new metric, the state recognizes that there are some disadvantaged communities and community of color that have been disproportionately impacted by COVID-19. And these people living in these communities have higher rates of infection, hospitalizations, and deaths. And the equity metric that's been introduced focuses on working with counties to try to prevent these communities from falling behind the county's overall progress in trying to reduce case rates and positivity rates, and moving on to hopefully less restrictive tiers. What the state does is it looks at Healthy Places Index. It's a tool that was created by a group in some counties in Southern California. That tool, as it currently exists, looks at a variety of data on people and communities, and looks at them by, groups them by census tracts. And based on the demographics of the community, those include, just as a couple examples, the percentage of individuals in that census tract living above or below poverty level, percentage of individuals that are employed, percentage of individuals that have higher educational degrees, for example, and a variety of other factors, assign a Healthy Places Index. And those factors in the index correspond to, as is described by the folks that created this index, correspond to how healthy the environment is, and consequently translates into life expectancy based on where you live. So this index has been used by a variety of government organizations and other agencies as a tool, and when they're looking to track how different communities with different indices are faring with certain conditions. So the state of California decided to use this index as a way to track COVID-19 and how communities in various within the counties are progressing in trying to reduce the transmission of COVID-19. The state was specifically interested in what they call the lower quartile. Quartile is 1/4 or 25% of the population, or in this case, of the census tracts in Monterey County. So they look at California looks at all the census tracts in Monterey County, and looks at the Healthy Places Index that was assigned by the group in Southern California to each of those census tracts. And then it looks at those census tracts that have, in our county, that have the lowest, or 25, they're in the lowest 25% of census tracts with the quality index. So, excuse me, the Healthy Places Index. So if we had 100 census tracts in Monterey County, each of the census tracts would have been assigned a Healthy Places Index. And then the state looks at, okay, what are the 25 census tracts that have the lowest Healthy Places Index, and groups them together. And then the state looks at the positivity rate for each of those census tracts and then averages it out. And then finally, the state averages the positivity rate for the lowest quartile census tracts and compares it to, uses it and compares it to the thresholds for positivity rates that the counties must meet. So what we finally arrive at is not only a positivity rate for the entire county that needs to meet certain threshold to move on to tier 2. We also have a equity metric based on positivity rate for the lowest quartile census tracts that also must meet a threshold to move into stage 2. So some people are interested and want to know where those census tracts are. And so this is a map that shows in the darker orange color the census tracts that receive the lower healthy places index. And you can see that if I zoom in a little bit more to the north part of the county, it's mostly the Pajaro area, Marina, parts of Seaside, and also census tracts around and in the city of Salinas. And as we look down to the lower part of the county, we can see that the census tracts in this lower quartile include the communities of Gonzales, Soledad, Greenfield, and King City, and San Lucas. So going back to adding the new metric to the existing metrics for putting us into our tier, we see that on the left here, the Monterey County's blueprint metric as of most recent one was we had an adjusted case rate of 10. And so that is greater than 7. So you can see that that keeps us in tier 1. And then the existing county positivity rate, most recently reported by the state, is 5.4. It actually falls between 5 and 8%, which is the criteria for tier 2. So the county test positivity rate actually meets tier 2 criteria, MEA. And then the new metric, which is the lowest row there, the positivity rate for the census tracts in the lower quartile is set 7.3, and that is less than 8%. And so you see that also meets the tier 2 criteria. So because although we 2 out of 3 metrics meet criteria for tier 2, although that we have that, we still have one criteria, the case rate, which meets criteria for tier 1. So for now, the state will keep us in tier 1. This is another way of looking at it. This is looking at first the case rate, and the blue line represents the various weekly case rates that we've had as reported by the state of California. And the most recent case rate of 10, which is adjusted by the state, is below 14, a case rate of 14, which allows schools to submit waiver requests to bring kids back into the classroom, but still above 7.0, which is the threshold to get into tier 2. And then the black line represents the positivity rates for the entire county, and that's over time. And the most recent one was reported as 5.4 by the state. It is less than 8, as I mentioned, so on that basis we would qualify for tier 2. And then the gray, the new data in the gray is the case rate for the average case rate, positivity rate for the census tracts in the lowest quartile. And so the last 2 reporting periods, we had, excuse me, one sec. I apologize. So these really should be saying positivity rates rather than case rate on the line. So the positivity rate is 7.3, and it is less than 8. And so both of these meet the criteria, the positivity rate criteria for tier 2. I just want to point out that our countywide positivity rate is very close to criteria for tier 3, actually, which has even fewer restrictions on business sectors. We'd have to be at least 4.9 to actually get it to meet that threshold. And the 7.3, I believe, will have to be close to 4.9. It doesn't have to go all the way down to 4.9, but it has to come close to 4.9. And if we were to actually meet that criteria, even though our case rate remains in the purple tier, the state would consider allowing the county to move into tier 2. So I just want to point out one more thing, and people are very interested in the case rate and the positivity rates because and the new metric because they realize that's how the state is determining what tier a county is in, which determines what the level of restrictions that schools and the business sectors have to comply with. And so by all means, we definitely want to reduce the case rate and positivity rate because it's of course better for our community. It's healthier. We would have fewer hospitalizations, fewer illnesses, but it also is good for the economy to move into a less restrictive tier. So how do we do that? We still have to follow these infection prevention measures. We have to continue to keep distance from one another if we're not in the same household, use a face covering when we're outside, and wash our hands frequently. And schools and businesses and the public still need to follow state guidance as well. But by all means, if anyone's sick, they need to stay home, or if they've been in contact with someone with COVID-19, they should also stay home. And we, as Karen Smith mentioned, we're still doing what we can to work with the state and work with the federal government to make testing more available to Monterey County residents. And so really encouraging people to continue to get tested to know whether or not they have COVID-19. And if you've been exposed to someone with COVID-19 and you're in quarantine and you want to know if you've become infectious, you could also be tested to see if you have COVID-19. And by all means, please adhere to isolation and quarantine guidance because that's how people with COVID-19 can prevent further spread and not contaminate or expose other individuals. So that's what I got as an update today, Matt. Thanks.
Thank you very much, Dr. Moreno. And if you could stay on the line for questions, that would be terrific. Now we're going to move on to elections. We're pleased to be joined by staff from the Elections Department to talk about election safety. COVID has really changed a lot about the way the county is managing elections, and it's a new way of doing things. Who have I got on the line?
You have me, Matt. This is Claudio Valenzuela, Registrar of Voters. And with me is Aina Gutierrez. She is Outreach Program Manager. And Gina Martinez, our Assistant Registrar. I apologize, my camera is not working at the moment, but I do have a nice picture, I hope, in there. So let me tell you a little bit about this COVID conducting an election under COVID. You know, I said before that conducting administration of elections is not for the faint of heart. And of course, conducting an election under COVID is just adding another layer of complexity and challenge to us. But I'm happy to report that we've received all our PPE from the state to be used at our office, at the early voting centers, and of course at the polls on election day. We are conducting some of our poll worker training online and some in person for the new poll workers, following all the CDC guidelines and of course our local guidelines. Speaking of that, I'm happy to report that we do not have a shortage of poll workers, but we still will sign up people and add them to the pool and keep them as reserves. This is very important. Also, I'm happy to report that voters are already voting. We're able to mail our ballots 5 days ahead of schedule. And so we wanted to give our voters as much time as possible to return their ballots. And I can tell you voters are returning their ballots swiftly this week. We have received over 8,000 ballots already. Normally we receive maybe a couple thousands the first week, and the week is not over. So it will grow. So that is a good sign of a high turnout. And speaking of early voting, we also open early voting center in Seaside at the Embassy Suites. And people are already visiting that location. We want to encourage people to vote early. so they can be safe. We encourage people to return their ballots early as well, so we can get this process going. And I think that is all I have.
Thank you. That is great information and great news about a big turnout for the election. And if you could stay on the line, Claudia, in case we've got any questions for you, that would be great. We've got one more topic to cover in our briefing. And those who were monitoring the Board of Supervisors meeting yesterday know that the board approved a renters relief program. And we're pleased to be joined by Lauren Suan-Supa from our Social Services Department and Josh Madfis, I hope I'm saying that correctly, Josh, from United Way, who'll tell us a little bit about this program, which is just a real great program for people impacted by COVID.
Hi, thank you, Mia, for inviting us and giving us an opportunity to help spread the word about this program. This is brand newly launched, the Emergency Rent and Utility Relief. This is the 1.25 million that was allocated by our county's Board of Supervisors specifically for rent and utility assistance for low-income Monterey County residents who are facing some housing instability issues, specifically due to losses or reductions in their income from the COVID-19 crisis. I'm hoping that Josh will help join me in sharing a bit of information about how the program is going to work, because we've really been able to partner up with United Way and their infrastructure to help us make this program as easily accessible to the public as possible.
Yeah, absolutely. So the way the program works is that residents who are interested in receiving either rent or utility assistance can call the 211 information and referral hotline, and then a call specialist would administer an intake form, which would document the resident demographics and create a unique identifier number, and then implement a survey, so a rent and utility assistance survey to determine eligibility. If they are determined eligibility, then the resident is made aware of the required documents that they need. They would need to, they would get a list of agencies that are actually paying the benefit, and the resident could choose the agency that they would want to go to receive the benefit. And then the call specialist would send a referral through an automated system to the agency that's paying the benefit. And then the resident gets an email as well that informs them about the agency that they need to go to, the documents that they need to bring with them to prove that they're eligible, and then the amount of funding that they're eligible for. The paying agency, when they get that email, they log into the system, and then they can access the resident's profile. They can connect to the client and then upload the documents. And documents include things like they have to be below a certain income threshold. So it's 80% the area median income. They need an ID with a photo ID with name and birthday. They need to just prove that they've lost income due to COVID, and they would need a lease or letter from a landlord, a utility bill, and then the landlord's address and tax information. So they get all this information to the paying agency. The agency reviews it. Once they accept it, they upload it to the system connected to the file, and then they make a payment directly to either the utility company or to the landlord. And that's pretty much the system. That the great thing is that we get real-time reporting. So as soon as they document the amount paid, we can see how much is paid, where it's been dispersed throughout the county. We can disaggregate by demographic, by age, and we can really sort of track real-time how the money's been spent. We've got about 11 agencies throughout the county that are paying the benefit, and we've got cities, we've got some faith-based organizations, and several nonprofits. So that's it in a nutshell.
Thanks, Josh. And I was just trying to share that list there that helps the community know where they can go if they want to directly, go to one of our participating partners, but also, easy access 211, super easy to remember, super easy to access. And keeping in mind that, while we have some of these requirements that people need to provide, we really have done as much as possible to make multiple avenues to provide that documentation, forms and such. So we're really happy to, the launch of the program is active now. So we really encourage people who are in need to please reach out to 211 or one of our participating providers right away. Thanks.
Thank you very much. What a great program. And I did see on among our attendees is Kevin Nguyen from the Small Business Administration. He was not on my list today, but I'm sure happy to see him because perhaps he's got some new information or updated reminders for those who may be making disaster applications. Hi, Kevin.
Hi, ma'am. Yeah, we do. And we have approved over 167 loans for $18.6 million. And I broke that out yesterday when I was at the Board of Supervisors meetings. $9,200,000 have gone to Santa Cruz County residents only as well. And I know we're in Monterey, but that number is only increasing. A lot of applications still in line. SBA, they're going to FEMA and SBA, they're going to extend the deadline to apply. I believe it's going to go up to November 21st. A press release will come out with that. So that's the new news that's coming out as well. Applications still can be taken and then register with FEMA 1-800-621-3362 and then sba.gov/disaster to fill out an SBA loan application. More than happy to take questions and then I'll be on again next week as well, ma'am. Thank you.
Thank you very much. It's really great to have that great news that it's working for people. So that's all of our presenters at this point, and we can start with our questions, and I've got a lot of them in chat, so I'm just going to go ahead. And the first question is for Dr. Moreno. Which local schools or districts have applied for elementary school waivers, which were sent to the state and which were approved by the state, if you know?
So Matt, I would be happy to share those that have been approved. I don't have permission from the other applicants to share, but they've applied as of today. But I can tell you that, let's see, it is, excuse me one moment. Those that were approved are All Saints Day School, Anthem Christian School, and Chartwell School.
And those were approved by the state, just for clarification, or approved that you sent to the state?
Correct. So those schools can, once they have trained their staff and have the resources to implement their plans, they can resume in classroom instruction this school year.
All right, thank you very much. Dr. Moreno, I think this may be another question for you. Governor Newsom said last weekend that restaurants, diners should put on their face mask between bites. Will the county enforce that rule, and do you expect municipalities to enforce it in their jurisdictions? How many COVID infections have occurred at Monterey County restaurants?
Okay, so I'm not familiar, unfortunately, I wasn't able to hear the governor, so I'll have to go back and see what he said and what the context was. As far as the number of outbreaks, we have, I don't have information, or I'm not prepared this afternoon to talk about the number of outbreaks or the transmission in outdoor dining at restaurants at this time. But I can share that that outdoor dining is still better than indoor dining. And so we want to take advantage of the opportunity for any restaurants that want to provide outdoor dining. It's still very important, though, to make sure that that business make sure that their employees are following state guidance for face coverings and distancing. And also really want to encourage people who go out to dine in outdoor dining establishments that they please continue to be respectful of the efforts of the management and the workers there to wear face masks when it's appropriate, and also to maintain physical distance between other patrons and the workers.
Thank you. And another question for you, Dr. Moreno. If the county test positivity rate and equity metric test positivity rate both remain below the state limit of 8% for 2 weeks, will the county be allowed to move into Tier 2, even if the county's case rate remains above the state limit, 7 cases per 100,000 population?
Right. So thanks, man. So I'll try to answer that question with a little bit of explanation, if you don't mind. So the Monterey County, being in Tier 1, could move into Tier 2 if the following three things criteria met. One is the case rate falls into the criteria for red tier, and both the equity metric and the county positivity rate both fall into below the threshold and fall into tier 2, and we've met that criteria for 2 weeks, Matt. So as I understand it, though, there is a second way to get to Tier 2, and that is even if our case rate stays in the purple tier, if our positivity rate for the county and the equity metric based on positivity rate both fall into Tier 3 and stay there for remain there, then the state would consider allowing us to move into Tier 2. And so we will be tracking not just the positivity rate and comparing it to the red tier criteria. We will be tracking to see if the equity metric and the positivity rate fall into Tier 3.
Great, thank you. Another question, what policies will the health department implement to comply with the state's health equity requirement? Will compliance with the equity metric requirement prolong Monterey County's movement into the more favorable tiers?
So thank you. So again, I don't want to predict the future. We're still in the middle of a pandemic, and things are changing weekly sometimes. So currently, though, from what we know, the positivity rate and the equity metric are both meet Tier 2 criteria. And so what we'll need to do is we've met that criteria for Tier 2. What we need is to have our case rate drop down into the Tier 2 range. And again, even if our case rate stays in Tier 1, if our positivity rate and our equity metric fall into Tier 3, the state may consider allowing us to move into Tier 2.
Thank you. And I've got a question for you on our deaths that were reported in Monterey County. Is there any information if these individuals had underlying health conditions, and are they all adults?
A reasonable question. I've been able to answer this question in the past, but unfortunately I didn't check with our epidemiologist prior to today's media briefing to get information on the deaths. So I apologize for that.
And I think we can try to get that for the requester by the end of the day today.
Certainly.
So going on to some questions, and again for you, Dr. Moreno. Last week, the county warned businesses against hosting live music at restaurants and pointed to the CDPH rules that live music is not allowed at public gatherings or community events. Given that, why did the Public Health Office allow Sunset Center to host a live music event last weekend?
So thank you. I'll have to go back and look at what was permitted. Maybe you can get some more information on that, and I can go take a look and see what happened.
Yeah, and I think there are other staff at your office that were working on that, and we can try to pull that information together.
Yeah, so there's probably someone else in the health department who was working on that request. I'm not sure it was me, so we can go back and ask and find out, get more information.
Okay, thank you. Another question for you. Last week, the CDPH said our case rate was 10.6 for the week ending September 19th. During that week, the Public Health Office said we had 563 new cases. Yesterday, CDPH said our case rate was 11.2 for the week ending September 26th. But during that week, the Public Health Office said we had 417 cases. Why is their case rate moving in the opposite direction from the numbers that your office is providing?
Let's see. So I'll make sure I understand the question. Is it, why don't you go ahead and read it one more time, ma'am?
Are you able to see this in chat? Does the chat come up on your,
Oh, yes.
screen?
Yeah.
Take a look at that, and I'm sorry if it is a little
No,
complicated question.
Okay, so what time was the question asked or submitted?
This was, I don't have a time, but it's under Kelly Nix's name.
At 12:08?
I don't have a time
Oh,
stamp
okay.
on mine.
Okay.
It was about the fourth or fifth, maybe the fifth question in.
Okay. Okay, so so there's a lot of things to consider here. So the case rate by the state, there's a case rate that the state calculates on a weekly basis, and then there's an adjustment to the case rate, and then and that's reported by the state. We have on our website, we have cases and by week, and I'd have to go back and see whether or not the cases that are reported on our website are the same cases, reported the same and used this by the state or not. So that's something that I'd have to check with our epidemiologist on.
All right. Thank you for that. And I know this, there are several questions from the same reporter right after this, but I would like to go, when the lights come back on, I'd like to jump down and ask some other questions from some other reporters, and then we'll jump back up so everyone gets a chance to get their question answered. Dr. Moreno, how specifically is the health department going to address the large amount of cases in the lowest quartile of the county? And this is regarding the equity metrics. Are the mobile testing sites one way, and what are some others?
Okay, so yeah, thanks. So we are, the county are looking at the various census tracts that are in the lowest quartile, and looking at ways to, things that we've already done countywide and in those communities to try to decrease the transmission of COVID-19. And again, in order to get case rates down and to get positivity rates down, we have to get the transmission down. So what one of the things that we've been doing is, as a county has been, or as a health department, we've been working with other departments in the county and other organizations to continue to get messages out and new messages out to countywide, but also to those specific communities. So in working with our consultant, Nick Pasculi, we've been creating messages and that are trying to reaffirm the importance of infection prevention measures, such as avoiding large group gatherings and face coverings and staying home if you're sick. And also focusing on encouraging people to get tested, those that need to get tested and those who want to get tested. So the health department and other departments have been working together to do this. What we'll be looking at next would be to see if there's anything else anything that we're doing that we could enhance or expand upon. And also working with the state to see if they, specifically California Department of Public Health, Department of Social Services, and the California Department of Food and Ag, to see if they have any additional suggestions that they may have based on their experience with other counties who have similar communities that are experiencing high rates of transmission and high rates of high positivity rates and case rates in those communities. So those are some things that we're doing. We're also encouraging more healthcare providers in Monterey County to begin to collect specimens and submit for testing, and those that are already collecting specimens and submitting for testing to increase availability of that service. So the county does have some clinics, and so that's one of the things that we're doing, but we only have a portion of the primary care clinics in Monterey County, so we will really do depend upon other entities out there, non-county, to assist in making the submittal of specimens for testing for COVID-19 more available. And I don't know if maybe, I'm not sure Karen Smith is still on the line, doesn't look like she is. If she is, maybe she had maybe a few more things to add about what we're doing in outreach and education.
And I am not seeing her. And
I'm here.
There you go.
I'm here. I don't have a lot more to add. The hospitals certainly have been a good partner, and they're reaching out to our most vulnerable as well, and doing the same sort of outreach with media and digital advertising, and then being available to come out to the field.
All right, thank you. And then just a follow-up question for you, Dr. Moreno, from this previous question. With the new metric in place and based on the charts provided to the Board of Supervisors yesterday, is there a lesser chance for the county to get into the orange tier in the future?
So again, I can't tell the future. I think what really we have to focus on is as a community trying to support each other and reducing the transmission of COVID-19 in our community. The positivity rates and the case rates are, over the last 3 reporting periods, have been somewhat stable, somewhat level, and which means that I think there's still more that we as a community can do in trying to decrease the spread of COVID-19. And I'm hoping that if we can continue to make testing more accessible and follow that up with isolation and quarantine of individuals so they stop spreading the virus, I think that's going to, that will continue to contribute to a decrease of our case rates and our positivity rates, and our positivity rates in particular among the census tracts that the state is tracking now.
Thank you. And then this other question, what is the recommendation on who should get tested? Should asymptomatic people get tested?
Right. So we've been through quite a bit, Maya, since COVID started when it comes to specimen collection, testing and reporting here in Monterey County and throughout California. And as resources have waxed and waned, we've been trying to keep the community informed as to who really should be getting tested and who might have to wait to make sure that there's testing available for those who really need it. We're at a place now where many more providers are collecting specimens. So early on in this, there were a handful of healthcare providers collecting specimens, and now we have many more healthcare providers in Monterey County that are collecting specimens and submitting them to testing. And we also have laboratories now that have gone from turnaround times of a week or more down to 2 to 3 days, and sometimes within a day or two. So the circumstances continue to improve when we're talking about testing. So since there's more providers testing, since we still have the OptumServe sites, since we got pop-up testing, and now this the National Guard support for testing and quicker turnaround times, we believe that more people should seek out testing. So the California Department of Public Health still recommends that, still has had in the past priority lists, but at this point, we think that anyone at this point who wants to get tested should seek out testing. So, but in particular, if you've got symptoms and you want to get tested, then yes, you can still consult your healthcare provider to see if they will be able collect a specimen from you or direct you on where to get a specimen collected. And if you don't have a healthcare provider, we still have the OptumServe sites, and you can check our website to see where there are some testing opportunities available in and around Monterey County. And if you're been exposed and you want to know whether or not you've come down with COVID, then that's, by all means, please get tested so that you can know whether or not you need to isolate yourself and for how long you need to isolate yourself. If you're in a setting where you're at high risk of being exposed or you're high risk of spreading it if you were to come down with it and you have no symptoms, then yes, that's another group of people. So our first responders, our healthcare workers, people working in skilled nursing facilities, for example, by all means should seek out testing. But even at that, we think that there's enough testing access and quick enough turnaround time that someone who doesn't meet any of those criteria but wants to know whether or not they've that little bit of runny nose or that feeling a little tired might be a symptom. Absolutely, I think people should, with or without symptoms at this point, should seek out testing if they want to know if they're positive for COVID-19.
Thank you. And then I'm going to jump back to some of the questions that I had to jump over earlier because so many were submitted by one person. How many COVID-19 tests are estimated to be false positives? How many COVID-19 tests of all the tests performed in Monterey County thus far does the county estimate were false positives? And then there's some additional questions about how the county records false positives, and are false positive results included in the county's overall confirmed cases?
Okay, thank you, Maya. So as far as false positive, a false positive refers to a test result that doesn't represent the true status of the person that was being tested. So if someone is being tested for, in this case, COVID-19, and they really don't have COVID-19, and the test is positive, that means the test was positive and it should have been negative. And that's what's referred to as a false positive. So in the information about the rate of false positivity, really the best source is the information that comes from the manufacturer of the test and the laboratories performing the test. So that's where we could get information about false positivity rates. We do not have information about false positives, and that's because if a PCR test is positive and it comes to us, then that's treated as a positive, and regardless of whether or not the person actually had COVID-19 or not. We don't receive information from providers or laboratories that a test was positive and was actually negative that we could track and report out on. Now, we may have reports from laboratories or providers that have concerns about false positive test results. And if the providers have concerns, then they can get a hold of us, and we and our public health lab director could work with them to help them understand more about the test that they're using, help them understand what the false positive and false negative rates are for that test, and help them understand what population is best served with the test that they have in particular. So I'm not sure I was able to answer all the questions, but hopefully I got to most of the question.
And thank you very much. And it is a wrap-up time for the media briefing. I see there are one or two additional questions that are still in the chat. We will forward those and try to get a response to those as soon as possible. Thanks everyone for joining us on the briefing today. Our next briefing will be next week, and we'll see you then.